I put in all of my medical data as of, before the diagnosis. Everything that my prior doctors were looking at and trying to figure out, like, why didn't they catch this? So where my doctors were saying, gas and, stress or depression, my AI agents were immediately saying, you have some kind of plasma cell disorder. You need to get a free light chains test and maybe a bone marrow biopsy. It just immediately were right on the money. The foundation models, from OpenAI and Anthropic and Google and XAI, the foundation models all have been really, really trained on the details of medicine. And maybe it's just because they could get their hands on all of it, or maybe it's because they realize that medicine is one of the major applications of AI. But for me, the foundation models were way better than any medical models. So this is going to make an extraordinary difference in medicine.
Time for our favorite podcast, Cut to the Chase. Have you been to the doctor and not really been convinced that your doctor knows what your issue is? Maybe misdiagnosed it, maybe not really even understood what your concerns are. Maybe you were thinking to yourself, hey, maybe I should try, maybe some AI would help my doctor or whatever. Well, I'm bringing on Steve Brown, serial entrepreneur who actually had the experience of having these mysterious symptoms, going to a doctor, being told that it's gas or depression. Then he took the AI bulls by the horn and figured out, unfortunately, that he had cancer, but he got the diagnosis right. He's under treatment. Not only did he do that, with his serial entrepreneurial background and his experience in AI and healthcare, he came back, he decided he wanted to create a company, a healthcare company that is going to help a lot of us deal with all the typical issues that we are faced with. Delayed diagnosis, misdiagnosis, all that type of stuff. Steve, how are you doing? I've said too much as it is.
I'm doing great, all things considered, I should say.
All right. So I want you to validate that story actually did happen with you. Let's tell.
Close, very close. I had experience that it turns out, as I've gotten to know many people with cancer, have had a very similar experience, that it was misdiagnosed initially. In my case, I knew something was going on. I'd lost weight. I wasn't feeling well. And I turned 60, so I went to the doctor. I went back to the doctor. I'd been seeing a doctor. Went back to the doctor, and I just said, I want everything under the sun tested, full body scan, colonoscopy, gastroscopy, heart scan. I want to test everything. I want no more excuses, because I was planning on starting a new company related to AI, not in medicine. I'd already I'd done a medical company 20 years ago, but I was like, life's too short to do another medical company. Medicine is challenging and takes forever, and AI is moving fast. So I was getting ready to start an AI company. But something was going on. My doctors couldn't really, my cardiologist said it was a fishing expedition. My gastroenterologist said, I think it's just gas, take gas X. And then what happened is that those big fires in LA, January 8th, the Palisades fire burned our house down. Us along with 11,000 other people. So that kind of displaced us out of Los Angeles. So we were ended up near Palm Springs and Palm Desert, staying with some friends. We went out to a big steak dinner at the Ritz-Carlton one night, to kind of just have a nice dinner out. And I came back with just horrible pain that over the whole weekend, thinking I was obstructed somehow. And I ended up going in as sort of an anonymous person off the street. My wife drove me to the emergency room. So I went in, kind of as not to the doctors who knew me, and as just a person off the street going into the emergency room with a bunch of pain. I got new scans and new tests, and the hospitalist in the emergency room said, in their typical bedside manner of a hospitalist, cancer until proven otherwise. And I got admitted to the hospital, where they did a bunch more tests and biopsies. And it turns out that I have a rare blood cancer that's, say, related to multiple myeloma, but not multiple myeloma, but kind of in the same family, a cousin of multiple myeloma. And while I was in the hospital, I started, just wondering, like, why the heck didn't we catch this sooner? I just had everything under the sun tested like 3 weeks ago.
Yeah.
So I ended up kind of repurposing some of the AI agents that I'd been working on for other things, to be medical agents. And what I did is I put in all of my medical data as of, before the diagnosis. everything that my prior doctors were looking at and trying to figure out like why didn't they catch this? So where my doctors were saying, gas and stress or depression, um, my AI agents were immediately saying, you have some kind of plasma cell disorder. You need to get a free light chains test and maybe a bone marrow biopsy. I mean, it just immediately were right on the money. So that was an epiphany of kind of two different things. One is, wow, the foundation models, from OpenAI and Anthropic and Google and XAI, the foundation models all have been really, really trained on the details of medicine. And maybe it's just because they could get their hands on all of it, or maybe it's because they realize that medicine is one of the major, major applications of AI. But for me, it was, the foundation models were way better than any medical models. So there's a massive amount of knowledge that is organized into this black box of an AI model, and it was really well trained on medicine. And the other epiphany was that this is going to make an extraordinary difference in medicine, because the challenge with medicine is that there's so much medical knowledge and it evolves so fast and there's so much new every day that's not possible for even the best doctor in the world to get his or her head around all of the new knowledge. So you end up, what you look for what you look for, and you're going to miss a lot. You're going to miss a lot because you don't, and that happens all the time. So, we eventually find the diagnosis when things get to a more extreme state where things are really clear. But, you kind of don't, if I had waited for it to get to that extreme state, I would be in with a very, very different prognosis.
Yeah.
But, we caught it relatively early, primarily because, fresh set of eyes and a new health system that had no history with me.
All right. So for those of us that are not like AI savvy, walk me through the details. Like you're getting all these scans, you're getting all this medical information. What did you just take all of that and put it in OpenAI? Like, walk me through that.
Well, I mean, you could just take all that and cut and paste it into ChatGPT. And I'm sure that lots of people are doing that today. The issue with AI, I mean, AI is it's inherently it is in a computer. It is ones and zero. It is like known states. It is deterministic, but it's not predictable. It's so complex that it's not predictable. It's like the three body problem. Little changes make big differences in the outcome. So depending on how you ask the question, you get different answers. So it's not exactly what you're looking for in medicine. If every time you ask the question in a different way, you get a different answer, that doesn't really give you a lot of confidence.
Yeah.
So I'm an application builder. I'm using the foundation models, but there's a whole layer on top of it. It's not like type this into ChatGPT. It's more like here's 100 pages of stuff organized in a way that I can get a more consistent response around what I'm looking for, and it's something that's more trustworthy. And I'm not just doing it once. I'm doing it with 16 different points of view, 16 times with different agents, and I'm having those agents challenge each other to I saw Microsoft just release something a couple days ago where Mustafa Suleyman called it a chain of debate. Well, I was showing chain of debate between agents. Actually, a year and a half ago, I did a 35-minute presentation on this at the Abundance 360 conference with Peter Diamandis. Having agents kind of vet each other, have a tournament of ideas where you do have different points of view, different ways of probing the knowledge, and they kind of need to kind of go back and forth until you find the best answer. So I was already doing that methodology. I kind of created this methodology for doing this, and I was using it. I was using it more educationally. But what I showed at that conference, the Abundance 360 conference, I gave examples of like, here's how we could advance knowledge in physics. And I had different physicists debating each other, and I gave them a set of rules. And I had another example from medicine. But in the case of my own diagnosis and treatment, it's, I wanted to make different points of view of like all the different medical professions, all the different medical fields, Those are different points of view. What is a different point of view? It's a different pathway through the knowledge. It gets a different answer. It gets a different result. It's a different point of view results in potentially a very different answer, but or a slightly different answer. But by having like a whole board of medical agents kind of debate each other about my situation, I felt like this was a way of converging on a more reliable set of answers than just typing it into ChatGPT. The other thing is that, with I have a medical record. That's not changing. I don't want to go retype that in every time. So there's sort of practical considerations of organizing mountains of data and then organizing that for the AI. So that's sort of this application layer on top of a foundation model. So I was working at building an application layer that was organizing it for diagnosis and treatment feedback relative to my medical record, which was quite extensive because I'd had a ton of tests. So I had a lot of data.
Yeah. All right. So did the medical providers come up with the accurate diagnosis before you figured it out? Or did you tell them, hey, I just fed all my medical history into AI and it's telling me I got this blood disorder?
No, I had the diagnosis from the doctors. I was waiting for some further lab tests, the cytogenetics and some things that I was waiting for a couple of weeks for all the tests to come back in. So I already had a pretty good idea of what I had. They were waiting to start treatment until they had all the information, but the diagnosis came from the doctors. Now, the treatment decisions, the treatment I'm on now is mostly things that originated with me figuring out things from the AI and then going back to my doctors and saying, shouldn't we be doing this? Or can we do this?
Yeah.
So, the diagnosis, I had the diagnosis and I said, well, why didn't they catch it before?
Yeah.
And it turns out the AI would have caught it before because you worked with my old data and the AI immediately said, this is what you need to look for. So if I had had the AI, if I did even paying attention to this, I probably would have, the AI would have caught it when my earlier doctors didn't. But diagnosis is kind of a one-shot thing. You got your diagnosis. Okay, now what?
Yeah.
I mean, when you have cancer, you're presented with a lot of, there are a lot of treatment options, there are a lot of treatment decisions. And often it comes down to, do you want to do this or you don't want to do that? You decide. Like, well, how am I supposed to decide that? But in my case, it was like, here's what you have. Here's the standard of care. We're going to start you on the standard of care. Well, when I dug into the genetics of my specific cancer cell, something that the doctors didn't discuss, but I did find in the detailed detachments and reports in my chart. When I started looking at that, I started to ask questions. I started to say, well, and questions to the AI, not to my doctors, but the questions were, well, is the standard of care really the right thing for me?
Yeah.
And it turns out it wasn't the right thing for me. It turns out, and I kind of predicted it, and the AI predicted this, you're going to get resistance with this. And this is going to keep doing damage to your organs until you get this sorted out. But there are better things you should be taking. Generally in cancer, you get the standard of care until it fails, and then they try something else.
Yeah.
And then if you have something like I'm on now, which is off-label and doesn't have isn't FDA approved for my specific cancer and hasn't had all the clinical trials, it's like you might never get it, but they're usually only going to get it after everything else fails. But I was looking at it with AI and saying like, look, this specific combination, to be specifically, it's like, well, given your genetic variation, it's like the protease inhibitor is going to be less effective, but you need this BCL2 inhibitor. It's like that's like you've got a genetic variation of this that's very vulnerable to this. It's not approved for your disease. It's approved for leukemia and something else. But your doctor can prescribe it. But my doctor here wasn't going to prescribe it because it's off-label, and probably my insurance wouldn't have covered it if my doctor had prescribed it. But I went to UCSD and UCSF and Mayo Clinic, and I wanted to talk to people who were at the frontier of researching this field. And I wanted to talk to people who were exploring this, who were investigating this, who were doing trials on this. Their answer was, yeah, you should switch to this drug now. Yes, that's a good decision. Switch to this now. Don't wait. Um, because my cancer cells, it's not that the cancer itself will kill me, it's the cancer cells produce a toxin that will destroy my organs. So it's like I need to get it stamped out
Yeah.
fast so I don't get damage. I mean, I actually went to my new cardiologist and he's fantastic and very familiar with my disease. But he's like, don't think this is the only tool in our toolbox. There's always heart transplant. And I'm like, oh my gosh, I gotta get to the Mayo. I was on a plane to the Mayo Clinic, like 4 days later
Yeah.
to see the top, one of the top people in the world for this because like I need to be aggressive. I needed to be aggressive to prevent the damage. This idea of like wait till this fails and then try something else, that was unacceptable to me. So I did get on a different treatment. If I'd been going to the Mayo Clinic from day one, maybe I would have gotten put on this at day one. But that's Mayo Clinic. But the standard of care was not that's I, but I advocated for a different treatment based on deeper understanding of my condition, which I did through conversations with my AI agents about it until I really knew, until I've had a lot of knowledge about what I was doing.
So would you tell any of the doctors that have been seeing you for this, whether at Mayo or the original doctors, that you were doing this AI analysis on
Yeah.
your own? And how did they react to it? And in your experience since then, how has the healthcare community reacted to AI?
Well, it's been varied at Mayo Clinic. Mayo Clinic is very into AI, and Mayo Clinic is doing a lot of research on that. And my doctor there was like, "Hey, this is really interesting. This is something we're not doing. We should collaborate." And I did the same thing with USD and UCSF. I think the frontier of medicine recognizes that AI is an extraordinary new tool in the toolkit for medical research, precisely because it organizes knowledge differently. The old way of building medical knowledge is to keep everything the same and vary one thing and do a randomized control trial. It's like, hey, I want 1,000 identical patients, and then I'll give half of them the sugar pill and half of them the drug, and I'll see what happens. And so I test one variable at a time, and I learn something. Well, that works if you have 1,000 patients that have exactly the same thing. And that's how we develop medical knowledge since the beginning of the scientific method in medicine. But cancer, it's like if 1 million people get the same exact variant of COVID, you've got 1 million people that had the exact same pathogen, genetically identical or almost identical pathogen, and you can find, and even though people are different, you've got something where people have a lot in common. But if you've got 1 million people who got cancer, even the same kind of cancer, 1 million people who got prostate cancer, that's actually 1 million different unique genetic variations of a cancer that have never been seen before on this planet and will never be seen again on this planet. It's 1 million different, completely unique diseases. Now we can lump them all together and we can do a trial if our treatment is fairly crude, blunt instrument. But as we get toward really the solution to cancer, which is precision medicine that targets exactly what you have, the paradox is the thing that's actually going to cure cancer is precision medicine that targets exactly the unique cancer cell that you have and doesn't do any collateral damage.
Yeah.
But by definition, like how do you do a clinical trial on that? Everyone has something different. So I actually found my doctor at UCSF because he was recruiting patients for a clinical trial on this combination that I was looking at, that I thought I needed. And then all of a sudden I see the clinical trial, he's not recruiting anymore. We pulled the clinical trial. We're not doing the clinical trial anymore. So it's like, I have to talk to this doctor. Like, why did you pull the trial? Is it because there's something wrong with this combination? Like you don't even want to do a trial because there's something bad? And the answer was pretty simple. It's I couldn't get enough patients. I thought I had 10 patients, but I don't have enough patients. So I can't do the trial. But because everybody's unique.
Yeah.
And so cancer, the old way of developing medical knowledge with cancer is going like almost definitionally going to hit a wall as you get to more and more precision oncology. AI, on the other hand, thrives on this diversity of the fact that everyone's different. Like the way that medical knowledge kind of gets develops and synthesized in a neural network, like the more diverse, the better. And it's clinical trial, you throw out the outliers. Oh, this one doesn't really fit. We're gonna ignore that data. We want the outliers in AI. We want the diversity in AI. That's how you train a great, robust neural network, is with a lot of those case studies. So it's a different way of organizing knowledge. It's uniquely suited. Cancer is like the perfect application of it. So I recognize the real power of this, and I'm doing this with my own unique, genetic variation of my own cancer, which led to treatment decisions that I would not have gotten without the AI. And that's, again, just the start of the journey.
Okay, so I mean, from what I'm hearing, and you can tell me whether you even feel qualified to answer this question, is the clinical trial model, is that going to get supplanted by AI?
Well, I think clinical trials are, they're always going to happen in one form or another. But I mean, the way we have thought of the gold standard randomized controlled trial, where everything is, you find a whole bunch of people with exactly the same thing and you vary one thing, will increasingly become difficult to actually do to build knowledge in cancer, because if you end up with smaller and smaller groups, you end up with, like, he was trying to get 10 patients for this trial. Like, you end up with, you can't get statistical significance that way. You can't find enough people who are alike. So you need a different paradigm for how do you assess. You need a paradigm that can take the diversity of case studies and learn from that, rather than trying to set everything the same. So that's something that AI is uniquely, the neural network model of AI is uniquely suited to do. And, it's at the beginning. So we haven't fully gotten our arms around, like, how are we going to do this? But we know somewhere in this process, in this new paradigm, is where our solutions lie for cancer. So that's what I said. It's like, okay, well, I'm going to take on that mission. Like, we know that AI is going to be, make a monumental difference in every field, but it's particularly going to make a difference in this field. And someone has got to lead that charge. So I took on that mission. That partly it's personal, but and because it's personal, it's like, I'm the customer. I'm doing it with my own data. I don't have any barriers to doing this. I don't have to go through some IRB to get permission to do this. I'm doing my own data. It's my data. I own this data. I can do whatever I want. So I'm able to advance the cause with myself and with a small group of people to figure this out. And as that grows to tens of thousands of people, then you start to have enough data to train models in ways that can actually infer from 1,000 messy case studies. You can infer things where a clinical trial you can only infer from a very uniform controlled approach, which is super valuable anytime you have something where you have a situation where things are uniform and you're varying one thing. But that reductionism, while it works for a lot of things, it doesn't work for complexity. It's incompatible with complexity. And cancer is the most complex disease there is, because everyone is different.
Yes. And as we talked before we went on here, talked a little bit about clinical trials, and you reminded me that President Nixon declared war on cancer, over 50 years ago. We're still fighting it. My father has contended for many years as a conspiracy in the entire medical world to make sure that the cure to cancer is not discovered, because then they'd all go out of business. I'm not sure I buy into that. I think that's a little too many people to keep that conspiracy going. But all right, so now you got your guy's serial entrepreneur, 300 patents. This happens to you. You already did the healthcare experience once before. You left that, and now you decided to come back, and you've created a company, CureWise.
Yeah. And
talk to me about that. What's it about? How did you get there? And where are you right now with the company?
So when I was in the healthcare business, 20 years ago, I was leading the pioneering effort for remote patient monitoring and chronic care for the expensive chronic conditions. And the motivation was, hey, if we don't fix this problem, it's going to bankrupt our country. And that was back when we were spending an ungodly $1 trillion a year on healthcare. Well, now I think we're spending four, or at least, and we haven't fixed it. So, and we are going bankrupt. So this still is an unsolved problem. But now it's personal, and when it's personal, it's like, well, gosh, I said this before, like no one really wants disease management. They want a disease cure.
Yeah.
And, now that it's personal, it's, yeah, like, of course, I want the best treatment that I can get today, but that's not what I really want. I want a cure. So what's the moonshot vision is, well, I do believe that the cure for cancer this is a different paradigm. The cures for cancer is going to come from precision medicine that precisely targets the unique genetic variation of a cancer cell that you have. So it's N of one, a very specific personalized precision medicine. And that's really only possible with this new tool in our toolkit called AI, because AI is actually suited for this kind of knowledge. But back to it's not that it's a conspiracy, it's that we haven't had the tools. The fact is, I am a very expensive patient, and it's mostly pharmaceuticals. I'm probably going to cost $1 million this year and it's mostly pharmaceuticals. But there's also a lot of health plans out there who really would rather not spend $1 million. So it's like as far as it's like there are a lot of people who don't want to spend the money too. So there are different interests. You could say that so that all of that money that's spent on my care is top line revenue for somebody, but it's also a loss for somebody else. But there's also like everybody with cancer also wants this to be solved. And there are people like me who are, there are scientists at heart and technologists and who are going to work on these things. And, I did do a healthcare technology company focused on chronic care, and we did need an act of Congress to motivate people to do the right thing, which is, let's prevent the super expensive things by catching them earlier. But, for a lot of things, that's become the standard of care. It's like now, 20 years later. This field will evolve. It will get better every day. But the big change, like what's different now, Nixon was like, hey, if we can put a man on the moon, why can't we cure cancer by 1975? In a kind of every president since, I think has had some version of the war on cancer, but we just haven't had this tool before. We haven't known how to organize all this vast array of messy data around a really complex condition before. That just isn't how we've organized knowledge before. But things are different with AI. This is a different paradigm for knowledge, and this is a tsunami that's like hitting every single industry. But it's just what I just saw from my own experience with it is it's uniquely suited to really accelerate this kind of long time moonshot to cure cancer.
All right. So tell me about CureWise.
So CureWise starts off as a set of tools for people like me who want to advocate for themselves and want to learn about what's going on and want to kind of become more of the expert in their own care so that they can have better conversations with their doctor. Because doctors will do, if you advocate for something and that something is right and you're right about, the doctors are going to do it. But if you don't advocate for it, they might not even tell you about it. I have things that, so my first thing was like just getting on the right treatment for me. But the second big epiphany was a longtime friend of mine, Sanyika Street. He told me about his brother. He said, I told him I had, he saw my talk and it mentions multiple myeloma and, I have the variant of that. And he said, oh, my brother just died of multiple myeloma. And then he paused and he said, well, actually not from multiple myeloma. He died from an infection.
Yeah.
And I was already getting kind of cocky, thinking I'd figured out, I kind of cracked the code with all my AI stuff. But then it's like, wow, all the stuff I'm doing is compromising my immune system. I could die of pneumonia or of COVID or something else. And, and a lot of people who did die of COVID had people who had, cancer because it's immune compromising. So then I'm going back to the AI agents and I say, what don't I know about that? What should I be doing related to that? And I discovered that there's a whole bunch of things I should be doing or could be doing. And, there's like, hey, my bone marrow is not making antibodies right now. Well, actually, you can get infusion with other people's antibodies. And, given the cross-section of people that probably donate blood because they need the money, there's probably a lot of very diverse set of antibodies in there. So I've been getting this IV immunoglobulins. I mean, basically, that like this is replacing the antibodies that right now my own bone marrow is not making. I'm also getting, prophylactic antibiotics, and it's like, not this one, do that one. And so my doctor said, hey, that's a good idea. Okay, we will do that. And then I got those things prescribed. But this came from me asking for it. And then, it's one thing if you ask your doctor for something and your doctor says no, well, it kind of has them on the spot. What if you were right?
Yeah.
But if you never asked, don't ask, don't tell. If you never ask and they never said it, it's like, well, we just did what the playbook said. We just did the standard of care. Standard of care didn't say to do that. So everybody's off the hook. Everybody's off the hook except the patient who's going to have to live with it. So that being able to advocate for yourself, there's just no question if you know more about your disease and you know how to advocate for it and you know what to ask for, you're going to get better care. So right now, what I'm building with CureWise, what we're building is that tool set that will help you advocate for yourself. It starts with getting all your medical records in there, having a bunch of different agents to talk to about your medical records with different points of view, and let them run kind of in parallel, and let them all analyze it and give their point of view, and then synthesize that to kind of give you another perspective on it. And I'm doing it with all the major models. So you can also do that in parallel. It's like, hey, let me take the hematologist point of view and my data and these questions I have, and let me run it against all the models at the same time and see how see how those answers come out differently, and let me synthesize that. Or let me take different points of view, hematologists, oncologists, gastroenterologists, different fields, and get different points of view, and then let those points of view debate each other until I get this, chain of debate, until I've learned something. And then let me go back to my doctor with that. So that's what I'm doing now. And it's already been transformative in my care. And it's a private beta. You can go to curewise.com right now and you can get on the waiting list. There are people that I'm letting in to try it and to use it, but it's fairly kind of controlled phase right now, and we're going to gradually open up parts of that more widely. But we're getting ready for this. This is going to be the best tool to help people who have cancer advocate for themselves. As we do that, and as more people do that, more people will have the opportunity to join in to be part of that. I say the research side of it is, well, how can we learn from this kind of messy collection of everybody trying to do these different, trying to understand the disease and trying to understand how to get more personalized medicine. We're going to continue to learn from that with AI, and it's going to be part of that quest to cure cancer with more precision and personalized medicine. We're going to use it to train better and better AI.
Yeah. All right. Now, I know this might sound silly to you. I mean, especially the level of advancement that AI has brought, but let's just say 15 years ago, I mean, I've got my own medical conditions and I researched the hell out of everything. So I'd go on the internet, I'd go to web.com, whatever, all the, Mayo had everybody's got, a platform or whatever, and I'd research it myself. And then I would go to talk to my heart doctor and I'd say, I researched it, and they would always, same thing. They would always roll their eyes and basically recommend me not doing my own research. And now I know this is at a much, much more advanced level. But my question to you is, when you get past beta, and this is a working platform, yeah, I would imagine a lot of people that want to be an advocate, they're popping in all this information, they're seeing diagnosis, treatment plans, and they can't really understand it too much. Is what you're going to be able to provide these customers of yours, let's just say an executive summary that they can show, hey, I don't understand this. I don't understand half of these words. And if I say it, I'm probably going to get it wrong. So can I just take this, executive summary and show it to the doctor and say, hey, here's what I found at CureWise.
Yeah, I think that's kind of the approach. It's like, help me talk to my doctor better. Help me have a better conversation with my doctor. What should I ask my doctor? I mean, it just starts from that. I'm maybe only going to get 10 minutes with your doctor. Like, how do you get the most out of those 10 minutes? And you're asking the right questions. And some of it is not even things you're going to talk to your doctor about. I'll give you another example of something I discovered with the AI that I wouldn't have found out with the AI, but it's like pretty significant impact on my treatment. So this new drug I got, which is very effective for me, and it's very expensive. I think the retail is like 25,000 bucks a month. And Blue Shield's paying a lot less than that, and it's way cheaper than a heart transplant. So it's a good deal for my insurance company, and I'm very grateful that they're covering it. But and it says that the pharmacist says, hey, make sure you take this with food. So I was, dutifully taking this with food every afternoon. Well, my questions I'm asking the AI is that now that I'm getting to the complete response territory, like, I'm getting down to the tail end of like wiping out the cancer cells, but it's in my bone marrow. There are a lot of places to hide in my bone marrow. It's going to get harder and harder the closer you get to, as you get to down there, it gets harder and harder to do. So what happens when I start to get resistance? So I'm asking the AI agents, it's like, well, my question was something like, hey, is there anything else about taking this drug? Is there some magic time of day? Is it better to take it in the morning? Is it better to take it at night? And the answer was, oh, it doesn't matter what time of day you take it, as long as you take it with fat. It's like, oh my gosh, I've been taking this drug for 2 months now. No one ever told me you need to take it with fatty food. I've been taking it with non-fat food. And so I'm talking to the AI about this. It's like, and the AI is, well, you've only been getting half a dose, or maybe even less. You haven't been absorbing it.
Yeah.
It's like, so I'll see what my test results say, now that I've been taking it for a week with fat, with a fatty meal rather than with a non-fat meal. So that's an example of something that, and it turns out it's like it is in the fine print somewhere in the pages of fine print, but it's like the little label says take with food. And have you ever read the 10-page fine print on your I don't know, I've never read those. I just do what the doctor says, take it, or the pharmacist says take it with food. So that's an example of some little piece of knowledge that could actually have a very material impact on how the drug works. Here's another example. Every week for 4 months, because I'm on this weekly schedule with chemotherapy, and I've been getting tested. I've been getting all the blood counts and all this, and the core blood counts is like the big measure of like how's your immune system doing. Well, I'm also supposed to take this big dose of steroids, and you got to take them early in the morning because they're going to keep you up all night. So, as the doctor orders, like take your steroids in the morning. Well, 5 hours later, I'm getting my core blood counts tested, and the AI is like, oh, I'm not really getting a test of my core blood count because 5 hours after you take this kind of steroid, it's like it's going to completely alter those numbers.
Yeah.
So I'm like, wow, every week for 4 months, we've been relying on these numbers.
Yeah.
But it turns out these numbers don't actually reflect what's going on. They reflect the fact that I took steroids 5 hours before. So I tried taking the steroids, not taking the steroids before I get the blood drawn, and sure enough, the numbers are radically different.
Yeah.
So that's like little things where it's like no one told me that. I probably would have, I don't know if it would have made any difference, but it's like there's a lot of important details that are going to get lost in the fact that you only have a very limited amount of time with your doctor, even if your doctor has the knowledge. That we don't have enough doctors. There's a shortage of all kinds of the human side of medicine. So everybody's compressed for time. So what we do is we follow the playbook, we follow the standard of care. We check the boxes, and that's really the only thing we can afford to do. But your unique situation is different. Your unique situation is you. Like if you want to spend the time to dig in, and I could pretty much guarantee that everybody I've ever met with cancer wanted to spend the time to dig in and figure out what's going on with them. It's helpful to have some tools that are designed to help you get more of those questions answered. And I know that other people have used the AI that I'm working on it's changed their conversation with their oncologist. In some cases, it's changed that's led to different treatment decisions. It's not the AI is not making any treatment decisions. The AI is changing the conversation and educating you. And if the AI is telling you something crazy, and you go to your doctor, and your doctor's going to say, no, that's crazy, like, throw that thing away. But and a lot of times, if you're just Googling it, you're going to find stuff that probably is not appropriate. And if you're just going to search PubMed, you're going to find some study, and is that really the right thing for you? Like maybe, maybe not. But when you're using AI, which has synthesized all of those studies and everything that's ever been written, together with your own medical record, you just might get something that's highly relevant to you. And it's not going to be like, hey, you should do this. It's like, hey, here are some questions you should ask. Here are some things that you might not have known about that you should look into. And then you look into it, and then you get more and more precise. In my case, I'm looking into it by, giving it the total, genetic testing of my tumor cell, which turns out to have a massive impact on which drugs are going to be more effective and which drugs are going to be less effective.
Yeah, wow. This has like been one of the most uplifting and depressing conversations that I've had in a long time. But all right, so CureWise, we're in beta. People can sign up and get in the wait list. Give me your projected time frame for CureWise. When are we going to go live? Is there
The goal is live for the general public by the fall. We're going to have a growing private beta, but they think there's a lot of kind of disclaimers and caveats in the private beta, so that needs to be managed very, very carefully. The AI is evolving rapidly. Learning how to apply AI into something that has very high stakes like medicine and cancer specifically. We need to do this very thoughtfully and carefully. And it is something, there are, depending on how you do things, it's a regulated industry. So we also need to be very careful about all of that. And just, there's a lot of talk right now about, regulating AI and how should we regulate AI. And the whole debate is like, hey, we can't lose the AI race to China. But I'm looking at it saying, this is the number 2 leading cause of death is cancer. If we overregulate AI and that slows down, advancing toward a cure to cancer by 5 years, how many million people are going to die because of that? So, there's like a lot of consequences for doing it wrong, but there's a lot of consequences for slowing this down and not letting this science advance rapidly. So I'm an advocate for let's advance this as fast as we possibly can, but the stakes are very high. So we need to be very thoughtful about how we do that.
Okay, so for anybody out there listening that's like very excited to get in touch with CureWise, get on the wait list, figure it out and all that, what do you recommend? What's the best way?
Get on the wait list, definitely, and follow our blog. Where the post that I just wrote today was related to some of the things we're talking about. That if 1 million people get COVID, it's this variant of COVID. It's they're all getting the same thing. If 1 million people get cancer, it's 1 million different things that have never been seen before. This is a different paradigm. And we're going to keep talking about it on the blog. We're going to open up parts of the application. Over time, we're going to start to open it up. But it's a private beta, so you have to be a little bit patient till we've sorted all that out. But we are inviting people in as we can do that thoughtfully. But definitely sign up, and you'll know about exactly how we're progressing with that. And it's a community that we really want to build, because in the end, the way you solve a complex disease like cancer, where everyone is different, is have a lot of people participating in that community, so we can learn from our differences, because there are people just like you out there. There are people close enough to you out there that the more of that we're able to bring together, the faster we're going to get to what people really want, which is a cure.
Gotcha. All right. So I think we're going to end it on that note. Steve Brown, serial entrepreneur with amazing, amazing story, personal story showing how he took the bull by the horns with AI, helped figure out what was going on with him, proper treatments. And not only is he doing it for himself, but he's going to do it maybe even for the whole world. So, Steve, listen, I hope it goes well with you, and you look good, you sound good, and I'm happy about CureWise. That's probably the most uplifting story I've heard in, besides immunotherapy and MNRA in a long time or whatever. So sounds exciting. And that'll do it for this episode of Cut to the Chase. Steve, is there anything else you want to that we didn't cover, or otherwise talk about?
Yeah, well, my last note on this is I want to say that, I mean, my doctors have been fantastic, and I've so appreciated the fact that they've been very responsive to what I'm doing, because I sort of was assuming that my doctors are going to hate what I'm doing. Like they're going to think Steve is a royal pain. Like, here comes Steve again. They're going to roll their eyes. But the fact is, my doctors, and I have a bunch of them, have been really interested, really curious. They know that there's going to be really some amazing advancements in medicine in the next decade because of AI. So, I want to say, like, thank you, and how much I appreciate them, because they've responded to what I've advocated for. And that's the only way I've been able to actually get on the treatments that have been more effective. And I want that to continue. So this is about helping you be a better partner with your doctor by knowing more about what's going on with you, so you can maximize the value out of that limited, that inherently limited time you're going to have with your doctor, so you can get the best possible result.
Yeah. And as you're talking or whatever, I'm thinking about Alzheimer's. They're so far, I'm just always reading about they're trying all this and they can't figure it out or whatever. Maybe this will be the solution here as well.
Yeah, medicine's complex. It's like, and we need tools that are designed for complexity, and that's what AI is giving us.
Gotcha. All right, folks, that's it. Look into CureWise. If you are your best advocate, you need to get informed, and don't hesitate to ask your doctor if they are using AI to help, with your diagnosis and treatment, because apparently that seems to be the thing to do. But Steve, thanks for coming on the show. Interesting topic. And that'll do for this episode of Cut to the Chase. People, share this episode. It's not about me and my numbers and looking good and all this. It's about getting the word out, because I think we're all in the same boat together here, fortunately. And so take care of yourself, Steve, above anything else. All right.
All right. Thank you. Thank you, Greg.
That's all for this episode of Cut to the Chase. But before you go, will you open up your podcast app and give us a 5-star review? You can also leave a comment about what you liked most or other topics you'd like us to cover. And please be sure to subscribe so you don't miss any upcoming shows. Thanks, everybody. Be safe out there.